Okay, our patient is a 72-year-old male who came in to have a left flank hernia removed. This is a hernia that occurs in the side of the abdominal wall. After the surgery, they also found that he was having heart failure and had to have a coronary angioplasty done where 3 stents were placed to allow proper blood flow through the arteries and help prevent the chance of future heart attack. Heart failure is when the patient's heart muscle is too weak to pump blood, preventing oxygen and nutrients from getting to the organs effectively. The patient was experiencing hypertension of 159/89 upon admission vital signs, and an irregular heartbeat was charted. The patient had a small amount of edema present in the lower legs. All of these symptoms returned to normal limits after the stents were placed. Patient has a past medical history of hypertension, being a smoker, COPD, sleep apnea, and chronic pain, all of which could have played a key role in causing this heart failure we're seeing now. During hypertension, the heart is pumping much faster and harder than normal to keep the blood circulating. Same goes for smoking and his history of COPD. Since this is causing difficulty in breathing and enough oxygen and eliminating enough carbon dioxide, there's less oxygen in the blood, so the heart is forced to pump harder in order to deliver the available oxygen around the body. Sleep apnea is also a major cause of heart failure because of the inability of breathing properly while sleeping. This results in low blood oxygen levels, which can increase the risk of abnormal heart rhythms, which weakens the heart. Upon assessment, the patient was still on a 2,000 milligram sodium and 20 gram saturated fat diet. Patient's at fall risk due to being over 65 and having had a recent surgery, but there are magnets placed outside of the door, and the patient is wearing a precaution armband. The patient also knows that they need to use a call light when they need to get out of bed. The patient's pain was at a 2 at the beginning of the shift on a scale of 0 to 10. So we need to, so we provided the patient with the daily morning aspirin prescription to help reduce the post-op pain and inflammation. There was no other abnormal findings during the morning assessment. All vitals were within normal range, including blood pressure, which was 137/82, and heart rate, which was at a 76. Patient was alert and oriented ×3, and they were supposed to be getting discharged sometime today. Patient has a PIV 20 gauge in the left forearm that is saline locked. There are no tubes or drains present, but they do have a surgical incision on the abdominal left flank from the hernia repair on 2/12/2019. The dressing is dry and clean and intact. He also has a puncture site on the right wrist from the coronary angioplasty on 2/19/19. This is where they inserted the stents into the heart. The site is covered by gauze and Coban and was placed in the splint for 24 hours and that'll come off at 2 p.m. today. The patient is experiencing a slight elevation in pain, giving a 2 on a scale of 0 to 10 due to having recent surgery for his left flank hernia. This can be expected since the incision is still trying to heal. Due to the recent stents placed for heart failure, some complications that we need to watch for are changes in blood pressure and heart rate that may indicate whether or not the patient is getting better blood flow and easier and more efficient oxygen. We also need to watch for changes in kidney labs such as BUN and creatinine that could indicate kidney damage or failure related to the reduced blood flow. The recent labs indicated patient has a BUN of 20 and a creatinine of 1.15, so there was no significant signs of kidney damage yet. Also, heart rhythm needs to be assessed regularly to check for arrhythmias. The patient's PIV line was being used for electrolyte and fluid balances as needed before, during, and after surgery, including fluids such as sodium chloride, but it is now on saline lock. The patient has 2 grown children that live out of state, but his wife comes to the hospital every day to sit with him. Patient's mood is calm and cooperative, and he was able to do many of the simple tasks by himself, like feeding, but he did need a small amount of help while walking to and from the bathroom and when he tried to walk around the unit, just due to some excess fatigue that he's having walking far distances. The patient was given this medications at 0900 this morning. His medications included alprazolam, which he takes to decrease anxiety. He needs to be monitored for changes in level of consciousness, sedation, drowsiness, and impaired coordination. He also needs to be taught about avoiding over-the-counter drugs, alcohol, and hazardous activities due to causing drowsiness. We need to make sure that he's not double dosing, and if a dose is missed, that it needs to be taken within 1 hour as scheduled. The patient is taking this medication due to the increased anxiety he's having with the multiple surgeries and tests being ran on him. The patient seems to be tolerating this drug well and is not having any adverse effects from it. Uh, Aspirin is also was also given this morning for its anti-inflammatory properties due to the recent surgeries to help decrease the inflammatory response and help with pain of surgical sites. This medication can cause increased chance of bleeding, nausea and vomiting, indigestion. So electrolyte balances, fluid balances, and red blood cell count needs to be monitored for changes. We need to teach the patient about reporting symptoms such as visual changes, allergic reactions, and bleeding. They shouldn't exceed the recommended dosage as it can cause acute poisoning. The patient is taking this medication because they have mild pain and swelling associated with their surgical incisions. Carvedilol is being taken for the patient's hypertension to control blood pressure through vasodilation. The patient needs to be monitored for chest pain, cardiac failure, and hypotension, so monitor the blood pressure and the heart rate regularly. Also assess for pain, including location, duration, and characteristics. Patient needs to be taught about complying with the dosage schedule even if feeling better. They need to assess blood pressure and pulse regularly and report if they have gained more than 2 pounds in a day or 5 pounds in a week. Medication must be tapered over 1 to 2 weeks because it can cause life-threatening dysrhythmias. Cyclobenzaprine is used as a muscle relaxant to decrease skeletal muscle pain in patients' degenerative disc disease. We need to monitor for somnolence, dysrhythmias, and headaches. Patient needs to be taught that the medication must be tapered over 1 to 2 weeks to avoid hazardous activities due to drowsiness and to avoid over-the-counter medications. Docusate Senna is being used for this patient for constipation since they are on a PRN opioid, which is highly known to cause constipation. Patients need to be monitored for signs of nausea, diarrhea, and abdominal cramps. So we're going to look at their electrolyte balances that could be potentially lost with diarrhea. We're going to assess their stool, including its color and consistency, its odor, and for signs of abdominal pain. Teaching about the medication needs to include normal bowel movements do not always occur daily, not to use if they're experiencing any abdominal pain, nausea, or vomiting, and that it may take up to 3 days for stools to actually soften. Take with a full glass of water and notify prescriber if it's not relieving the constipation. Furosemide is being given. This is a loop diuretic. It's used to help decrease the excess fluid that's causing their hypertension. The patient needs to be monitored for hyponatremia, hypokalemia, and increased thirst, all of which are caused due to the loss of water by the diuretic. Sodium and potassium are lost with the use of this diuretic, so can cause these patients to have low levels of these electrolytes, so the patient may need supplementation. We are going to teach the patient about the need for a high potassium diet or supplementation, to rise slowly due to orthostatic hypotension, and to recognize adverse reactions such as muscle cramps, nausea, and dizziness. Potassium chloride is given as an electrolyte supplement in order to increase the potassium level lost with the patient's furosemide medication. Patient needs to be monitored for hyperkalemia, hypervolemia, and nausea and vomiting, so keep an eye on electrolyte levels due to giving excess potassium. Patients taking this medication need to be taught to report hyperkalemia symptoms like lethargy and confusion, and to add potassium-rich foods to the diet such as bananas, orange juice, broccoli, and to monitor potassium levels periodically. Sertraline is being used to help reduce patients' anxiety. He also takes this medication at home. He needs to be monitored for insomnia, seizures, and hyponatremia. So we're going to assess for changes in level of consciousness often and changes in sodium levels. Patient needs to be taught that the effects may take longer than a week and to use with caution when doing hazardous activities due to its side effect of drowsiness. Spironolactone was also given to this patient for their hypertension due to its fluid eliminating qualities. This diuretic also spares potassium. We need to monitor for side effects such as hyperkalemia, hyponatremia, and bleeding. Teaching should indicate to avoid foods high in potassium content, to take in the morning, and to avoid hazardous activities. Tamsulosin is being taken for symptoms of patients' prostatic hypertrophy. Side effects to monitor for include angioedema, chest pain, orthostatic hypotension. Include teaching such as continue to take even after feeling better, and to never crush, break, or chew this medication. And then lastly, the patient was giving magnesium hydroxide around 1030 PRN for the heartburn that was related to the other medications. Patient did not experience any type of adverse side effects from any of these medications. The patient had no radiology tests done while at the hospital, but they did have a few lab tests ran, including their glucose, which was taken. They do this because there's a chance of increased glucose levels following surgery with the excess physical and emotional stress that the patients are put in. This level will remain stable today. Another lab test was drawn of potassium due to the patient being on both a potassium-sparing and non-potassium-sparing diuretic, as well as a potassium chloride supplement, which was in normal range. It was a 3.7. BUN was at a 20, which is just within normal range but still on the high side. This is potentially because of the lack of blood flow and oxygenation to the kidneys before the stents were placed. Patient is also working with other collaborative team members like cardiac rehab and care management. They were consulted due to the recent heart stents placement. After finding that the patient was having heart failure, the patient will require cardiac therapy after they are discharged. Our main problem is the patient is having acute pain related to inflammation of the skin and tissues, as evidenced by pink area surrounding the surgical incision with small amounts of swelling. Our goal is for the patient to have a pain score of 2 or less on a scale of 0 to 10 on this day of care. We had acetaminophen as needed for pain to help keep it under control and allow better, faster healing. The patient did not need any more pain medication after they were given their morning aspirin as scheduled. We also provided heat and cold compresses to help reduce pain and inflammation. The cold helps decrease inflammation and the heat helps with pain. This helped the patient in a non-pharmacological way. And lastly, I taught the patient to use a call light when they started to feel pain. This is because it's easier to control the pain if it's medicated early instead of waiting until the pain cannot be tolerated anymore. The patient called every time they felt pain. The goal was met. The patient was kept at a 0 on a scale of 0 to 10 after the morning pain medication was given. Our second problem was activity intolerance related to weakness and fatigue, as evidenced by only being able to walk short distances before needing to take a break. The goal was to have the patient walk 3 times around the unit on this day of care. We taught the patient to gradually increase the distance that they walked, because by increasing the distance little by little, it helps to increase tolerance. The patient did this by walking 40 feet the first time, 45 the second time, and then the last time they walked 50 feet. I also explained safety precautions to use while ambulating to help keep the patient safe. This included the use of gait belts, using the call light before they get up, and the use of non-slip socks. These are all just precautions to kind of help prevent them from falling. The patient called each time that they needed to ambulate to maintain safety. Lastly, we instructed the patient to use a balance of rest and exercise. Using this balance will help the patient increase their energy during times of walking. This really helped the patient as they had more energy to walk around the unit when they rested in between, instead of being up and doing other activities in between walking. Patient goal was met as they walked the unit 3 times on this day of care. And the last thing, we were concerned with the patient's ineffective health management related to complex treatment regimen, as evidenced by stating that they did not always remember to take their medications at home. Our goal for this patient was to increase health management and to have them verbalize 2 different techniques that they would try to use to help increase organization and to help them remember to take their medications. I provided a list of different techniques to help increase organization. A list kind of allows the patient to choose different options that work best for their schedules. The patient chose to try to use a pill box and to set different alarms when they needed to take their medication. The nurse also got a consult from the pharmacy to discuss the patient's medications, which really helped the patient learn why each medication is important to them and how and why they need to take them when scheduled. The patient stated that they had a better understanding of the medication by the end of this. And lastly, I verbalized how to use a pill box and asked the patient to reteach it back to me. By having the patient do a teach back, it allowed me to see that the patient had a good understanding of how to use it. So then I knew that they were capable of doing it at home. The patient correctly explained how to use the pill box. This patient goal was met because the patient was able to verbalize 2 different techniques that they would try to use to help them organize and remember to take all their medications. Today ran fairly smoothly as the patient cooperated with all the assessments and treatments. Many things went well today, including our head-to-toe assessments, where we found all of the patient's findings were within normal range, which told us that the stents were helping with the patient's blood pressure, heart rate, and blood flow to organs. One of the things that did not go as planned today was that the patient was feeling fatigued while walking long distances and so needed extra help to and from the bathroom and help getting dressed and cleaned up. The patient today made me feel very relaxed and they were very easy to talk to, so it gave me a big confidence boost in having conversations with them about their health problems and complications. I also had many medications to give and would have liked to felt more confident while passing them. As a nurse, I think I learned that it's important to keep track of when each of the PRN medications were last given. This is because it really helps when the patient asks for it to know right then and there, to be able to give them a direct answer about if they can have it or not, and also to know like what each of the pain PRN medications is for, whether it's for pain or heartburn or anything like that. If it's like a pain medication, for instance, it's a lot easier to keep pain controlled than it is to go from a really bad pain back to controlled again, so it's good to know in a quick manner what they need and get it to them quickly. With my patients being discharged at the end of the shift, I do believe that they were provided all of the care necessary while they were there. Not only did they have 2 different surgeries, but cardiac therapy, and the physicians also came into the room many times while they were there to assess the patient to ensure that he was in fact ready to be discharged. Yep, and that's it.